I know you manage investments. I mean, you're an investment person. So, what is one key investment opportunity that can expand healthcare access in local communities? One key invest, something like Chika said, catalytic kind of investment.
So when it comes to investments, we
Yeah.
have to look at it in different perspectives. There is an investment that you're looking for return on investment in money. There's an investment that you're looking for a social reform from that investment. So three things that is needed here: the government effort, philanthropic effort, then the private sector involvement to gain some return in investment. So one key thing that is needed is government policies. There's need for strong policies that will drive the private sector to be encouraged to invest in the local community. As Prof has rightly said, the policies are 20 years old. So if you look at them and you wanted to come into healthcare and invest, there's actually nothing attractive. And that is why you will see very few involvement of private sector when it comes to public-private partnership. I manage 6 hospitals.
Okay.
3 of them are PPPs.
Okay.
The last one was just signed 4 days ago, actually. A dialysis center built by Katsina State government with around 24 dialysis machines. My company has just taken it over 4 days ago.
Oh, wow. Congratulations.
Yes.
Congratulations.
But the policy of the government is they are ready to pay 50% of the cost.
Great.
So whatever the cost of dialysis is, the government will be paying the company 50% of that to encourage people. We also manage a diagnostic center built by Sokoto State government for the last 3.5 years, and it's up and doing. The policy of the government is to make the price cheap because they
subsidize the services.
Yes, they are not looking for a money return. They are looking for the value return. The people don't have to travel far to do CT scan or MRI, they can still have it. So with strong government policy, you will see a lot of private sector getting involved with the government. Governments have a policy, some incentives to the private sector will actually encourage a lot of business people to get involved. That policy on its own will actually revolutionize a lot. You see, the benefit of PPP has been felt in so many different countries. I can cite an example. In the UK, there's a company called Alliance Medical who has invested into nuclear medicine and radiology services in all of the NHS hospital. I worked with the company many years before I left the UK. At that time, they have 31 installations across the NHS. The entire nuclear medicine is not funded by the NHS. It's funded by Alliance Medical because there's a strong enabling environment for it to survive. How many PPPs do we have in Nigeria? In Abuja, I can only think of one, Garki Hospital, and that was 10 years ago. It's 17 years
17 years now. Yeah.
And if we've done it well, there should be many of that, including the National Hospital should be a PPP arrangement because there's a benefit the private sector brings. Apart from the finances, there's a strict management structure. There is HR policies that private sector can stand on and make sure things flows. The private sector will not waive the spending from the government, but rather make it more efficient. That's one thing that needs to be understood, that involvement of private sector does not mean reduction in expenses from the government, but rather it will make it that the benefit will be felt by everyone. And it will also provide sustainability to the investment.
Thank you, Doc. Thank you so much. So, I mean, key takeaways from what you've just said is that, one, these PPPs are already happening, so it's not rocket science. Some government in some states have provided counterpart funding to ensure that their population can access care in certain services at a time of need. And that's where we can encourage other governments to adopt. All right? So that dialysis that is supposed to be about 45 or 50,000 can now be priced like 20, 25,000 for the patient. Is that what I'm hearing? All right. But a private sector person coming into that investment is not just a social investment. That investment must be able to be sustainable in such a way that when consumables are needed, they don't have to go borrow money from the bank to buy consumables. It must be sustainable, you know. So I think that is something that we should think about. When you're entering these PPPs, there are different motivations for PPPs. To the government, the motivation will be different. To the private sector, the motivation would be different. But once that is understood, then you can structure a good framework.